pathian nei tlai lama te program hun health and wellness kan seminar atober program te min shwai thlen lewangi lom thu kan shilate kan hun man thuri ko ta kan ron lana mimal tim te tana dal pamal som na le kan tana changkai tor thu te kan zir ho na hian boina Hriselna te kan to lawa hun limom ta kan man ho theina ni kan hun te ko ta kan ron lan boke iswa mingin kan dil cha amen to say lag lo lai tholom khon kha alak lo palta kin tu na kan khon ngal menga khongai takin tlangwal Daniela le dong dong kha mi lo tlom ngai sakse tholom mi lo khon sak lok ton nia no pang hu ni hong don min te kan hong angem sei to rin ready am kan no pang ho kha ni chen tholom khon sak kan hong le me don ne pastor sang pui kha thong tai tang ko meng
trong trayang alpa min mangai tu voin tlai ewai in khoma te min roi khom le kan lo me tholom te kan ron la khoma kan tholom tho tak te nangin malmin som sakla thalai te ma kan lak zel ne tur le rong kan bol zel ne tur ta na mal som na nangin chantir tur che in lom tu sei chungin isu mingin kan di le amen
vo in nia hey Dr. Binsi kan soma hunte amala matang ren lo tak le question answer kan nei tampal takin ama ko masad achat karing zo ka chuta tanga program ate hun kan la nei chuanin seitura ka impo cha te kha karon sei Mizo ka nga ka thengil se mi lo thiaro na panghun ka na ong man sang at this time, I'd like to invite all the kids. And if it's all right with Dr. Binsi, I'd like to invite you after the children's time to speak. Thank you.
Lalpa thu sui ro icha lu na ngai kla Napa thu sui icha lu na kla Samuela pakat na pung tum jang kwa lalpa thu sui ro icha loi na ngai kla Samuela pakat na pung tum jang kwa lalpa thu sui ro icha loi in anek kla
At this time, I'd like to invite Dr. Binsi to come up to the stage and share with us Apple TV. Yeah. Can I ask you a few questions,
Sure.
just so we can get to know you a little bit? Okay. Go ahead to the closer to the mic. All I know and all we've talked about is that you graduated from Loma Linda University in
correct.
2017 with your Doctor of Dental Surgery, correct?
Yes, that's
Okay.
correct.
All right. Can you tell us a little bit about your hobbies? What do you like to do on your spare time?
I like to eat and sleep. Those are my hobbies. But I have a dog, so I like to spend time with him as well, hanging out with my friends, going on walks with him, my dog, watching shows,
Yeah.
TV.
Sounds good.
So I'm very laid back.
You are a member of Remnant.
Remnant.
Okay. So Dr. Bincy goes to the Remnant Church that we used to be closely associated with. So she's probably familiar with a lot of our faces walking in and out of the church. We're so grateful that you're here today. I know it was very much of a last minute request, but you just popped in my mind and I thought maybe just perhaps she has time for us because, within our church, I don't think anybody. We have a couple of nurses, and we are all in different fields, but dental health is something that we all need education on, and just to be able to, just be more informed. So we're so grateful that you are here today. Should I translate mid-conversations, or should I just do a summary just at the end, just in case? Ngay tan. Asay pa karon translate ang ngay. Ngay long. Pero ala kiu de ola katle min my ki. Okay. Let me just connect for you. Oh, you connect me? Okay. There you go.
Thank you. So as Rebecca mentioned, I've been a practicing dentist for the past 7 years. I currently am an associate dentist that works in Woodbine, Maryland, so that's North Howard County. So I've been there for almost close to 5 years now. So dentistry is a passion of mine. I've actually wanted to be a dentist since I was about 5 years old. So it's been almost a passion for over 25 years. So I'm very grateful, first of all, to God because He kept that passion, and He's the one who brought me thus far. And I'm glad that I'm able to help serve people because the whole reason I wanted to do dentistry was it was a service. It was helping take care of people's health. And it's a part of health that many people don't really pay attention to sometimes, or they don't realize the importance of it. So one thing I often hear as a dentist is this phrase: I don't like the dentist, or I don't like seeing the dentist. If I had $1 for every time someone said this, my loans would be paid off by now. So this is a common phrase. So why is it that someone might not want to see the dentist? Like, I'm asking the audience, the members here, what reason might you not want to go to see a dentist?
Childhood trauma.
Yes, that's the big one. I hear that one the most. Patients will tell me they were in pain, the doctor kept drilling on their teeth, they didn't listen to them, so they're traumatized, so they didn't go as an adult. And the pictures there are kind of like a help. Some people don't like the needle. That's scary for them. Some people think it's very expensive, and it can be. If there's a lot of problems, the money is the big thing that's preventing them from going. Also, the pain is there, and they rack up the pain, and they think if I go to see the dentist, they'll tell me about the 100 other issues I have. So that's one of the things, probably the most common phrase I've heard in my practice. Now, this is something for you guys. Why is dentistry important? So when you saw the picture, as the caption says, the first thing you noticed was what? The missing tooth, right? And it wasn't the missing eyebrow, because now some of you realize that there's an eyebrow missing, but it was the teeth that you noticed first, and that's a lot of times what happens. Me, because I'm a dentist, that's honestly like where my eyes go to first. Sometimes it's the teeth. So if you see me staring at your teeth, I apologize. It's not intentional. But what is dental oral health? The World Health Organization states that oral health is the state of the mouth, teeth, and orofacial structures that helps individuals to be able to perform functions such as eating, breathing, speaking. It also has to deal with psychosocial dimensions such as self-confidence, your well-being, and the ability to socialize and work without pain, discomfort, and embarrassment. So from this definition, one thing we learn is that oral health, it's part of your overall health. It also affects your mental health and your social health as well. It includes everything in the mouth, even the lips. So anything that's from the lips and inward is what's included in oral health. And there's often a link between dental health, and it's connected to cardiovascular issues as well, cancer sometimes, as well as diabetes. And this is so common that it affects everyone. So it's not just an old people disease or issue, it's also something that affects young people, it affects women, and it affects men. So everybody has something to do with oral health. Now, what are some of the benefits of having good oral health? And it's the following. You can have healthy teeth and gums. Your smile will be beautiful. Your breath will be fresh. You'll have to deal with less fillings, crowns, root canals, extractions, dentures. There's also a lower risk of heart disease, stroke, diabetes, and a lower risk of oral cancer. So, as you can see, that guy in this picture earlier, with the missing tooth, you can see he can have problems probably with eating. He might not be able to bite into it and enjoy an apple or a mango or corn, so that affects his eating. He might not have a very good social life because people might be making fun of him because he's missing a front tooth, and that's affecting him there. And because he doesn't have any friends, that's also affecting his social life. So it plays a big role. So some facts about dental health. In school-age children, about 60 to 90% of kids have at least one cavity. And as an adult, almost all of us here, probably all of us in this room, have at least one cavity. So we're all part of the problem. And then in adults ages 35 to 44, about 15 to 20% of them have something called gum disease, which the terminology we as dentists use is periodontal disease. So it's actually like an issue that many people might not know that they have because it's like a silent killer of teeth. Also, people ages 65 to 75, about 30% of them don't have any teeth at all. So you can see how that affects like your eating, and in turn it's going to affect your health as well. So common dental problems that are affected by our oral health is tooth decay, or some of you know it as cavities, toothache or tooth sensitivity, gingivitis, which is a fancy term for your gums just bleed a lot, periodontitis, which I mentioned earlier is a fancy term for gum disease, also cracked teeth, chips in teeth, broken teeth. Those are some common problems that probably many of us here have experienced. And the picture I have is actually a picture of what periodontal disease is. So the farthest one on the left side is how teeth and gum should be. So you all see just the top part in your mouth. Me as a dentist, I see in my x-rays the whole amount. So you see how gum should be pink, firm, and over time, if we're not taking care of them, our gums can become red, they can bleed a lot. That's early stages called gingivitis. And we are not taking care of that, it can get worse, and we start to affect the stuff under the gums, which is the bone that supports the teeth. And this picture I have is of tooth decay or cavity. So the far left picture is how teeth should be, which is healthy. And then sometimes when we're not doing what we're supposed to do, we can get a small issue in the outside layer, which is called the enamel of the tooth. And that's usually, we kind of watch it. It's not a big issue. But when it goes to that second layer, that's what we call a cavity. And that's when we have to do a filling on it. So once it gets deeper, if you didn't do the filling, it can get into the nerve of the tooth. And that's when you end up needing something like a root canal, which is painful as well. And then if you didn't take care of it at that stage, that's when you have like a tooth that needs to be taken out. So I always look at this, when it's healthy, that's great. That costs you no money at all. And like when you need a filling, that's a couple $100. A root canal, a couple $1,000. And then if you had to pull your teeth, it's more thousands of dollars. So you can see how by taking care of your teeth, you're also helping your budget as well. So I always like to focus on the prevention part of things, because that's the best way to avoid all these other issues, like having to not get a shot, not needing a filling, not needing a root canal. And it's very easy. This is all stuff you can do at home. So what we recommend is brushing, and we recommend doing it 2 times a day. And we also recommend using a soft bristle toothbrush. There's different types of hardness. Soft is the best. Also using something like an electric toothbrush, so people who don't have really good coordination with their hand, electric is doing most of the work. So it's one, being able to make sure you're brushing morning and night, and also making sure you're doing it for about 2 minutes minimum. So that's important too. Also flossing, that's that second picture. Traditionally the string floss is best, that's what our hygienists always recommend. But if it's harder for you to do that, using the one with the toothpick attached is much easier. That's what I use. And we recommend doing that 1 time a day. Also mouthwash will help. Fluoride, which is an ingredient in a lot of the toothpaste, as well as what you're eating, what you're drinking also is a preventative. And also going to see your dentist 2 times a year. That's minimum 2 times a year. Some people need cleanings a little bit more frequently than 2 times a year. But as long as you're going 2 times, that's very, very helpful. Now, one thing I touched on with the nutrition is some stuff that is really helpful. And this is what part of goes into your overall health. It's what you're putting in your body. And things that are helpful to your dental health are calcium, phosphorus, vitamin D, vitamin C, and antioxidants. On the opposite end, things that are not so good are foods that are high in sugars and carbohydrates. They can cause a lot of problems. And it's not just what you're eating, but what you're drinking as well. So as dentists, we often recommend water is the best thing, first of all. You're not gonna get any cavities with water. If you do drink something other than water, we prefer that you do it around the time you're eating, and also the frequency of when you're doing all of this. So if you're eating and then you're having a snack and then you're snacking throughout the day and then you're eating your next meal, that's also gonna create more cavities, more problems. Also hydration, by keeping your mouth wet, it's actually better. If you have something like dry mouth, the fancy word for that is called xerostomia, that actually can cause more cavities as well. So hydration is important, and what type of hydration you're having. So avoiding things such as sodas, sports drinks, or at least trying to drink sodas closer to a meal. And then the foods you're eating. So that little diagram is examples of good foods. But as I always say, everything in moderation. So it's not saying like cut off everything that's in sugar, but just how much of it you're eating, when you're eating it is also important. Also making sure you're brushing your teeth and flossing right after. So whatever junk is on your teeth, you're getting rid of it as soon as possible. So one takeaway from this, it's very just an overview of dental health, but I always say the 2-2-2 rule, which is the stuff that you can do at home. Brushing twice a day for 2 minutes, and then visiting your dentist 2 times a year. So that's easy to remember. If you don't remember anything else, just the rules of 2s, 2-2-2. So what was that? Can you guys repeat? For 2 minutes. Yeah, dentist twice, not brushing twice a year. Yeah, dentist twice a year, yep. So that was it for my topic, my,
Thank you.
yes. Oh, and I did have a demonstration, sorry.
Go ahead.
Okay, so this is just, so one thing I always have patients, they come in and they say they're brushing their teeth, and then I look in their mouth and it's full of a lot of stuff. So I have, this is from my school days. We used to have to work on these. They didn't have us working on real people right away. So this is pretty much what your mouth looks like that I see. So you only see this part, but I see all of it. And then the toothbrush, this is one of my own. you want to use, like I said, something that's soft. So, soft bristled. Anything harder will actually damage your teeth. So people who have sensitivity is sometimes they're brushing too hard. Sometimes it's a medium or hard bristle, and that actually damages your enamel. So when we say 2 minutes, this is what people struggle with. They're not spending enough time. And then also with your toothbrush, you want to, sometimes they're just brushing the front. So you want to start at the side and you angle your toothbrush to your gums. And then you go back and forth, circle motions, and you want to get all over your mouth. And you do the same with the bottom as well. And then you also want to get the inside, because even though nobody sees this, we see it as dentists. So that's how we clean. And you have to do this for 2 minutes. So sometimes timing, putting the timer on to make sure that you're spending enough time, and that will make sure that you have to see me less. So that's how you brush. And then flossing, I forgot my floss in the car, but it's very important. You get it between the teeth and you go up and down scrubbing the sides of the teeth. So some people just go in and out really quickly and then they think they're flossing. But it's just going in, scraping the sides of the teeth to get the plaque off, and then doing that at least once a day. And then other things that help are mouthwash, such as this, Listerine. It has fluoride, which is a good ingredient. That helps, as well as toothpaste and brushing your tongue. That's another important thing that a lot of people forget, brushing your tongue, because that's like a sponge that absorbs a lot of bacteria. So if anybody complains to you about bad breath, it might be you're not brushing your tongue. So that was my little demonstration. If you want to practice with this later on, you're more than welcome to. But yeah.
Thank you. All right, can we say thank you to Dr. Binsi? We'll do a little Q&A just in case some people have questions. Zona hun kan hong ako hun kan nei boka. Pastor sang pui hem lo pui se mi pui lama changa zona nei tan. Okay, I have a question. Well, maybe some people are thinking. Some of us might be trying to perhaps maybe whiten our teeth more in a natural way, or maybe are there certain products that are not as damaging but would be helpful? Is there anything that you recommend for getting our white teeth or our teeth whiter?
Sure. So I personally use it for my toothpaste. So one of the things I like is the Arm & Hammer whitening. I feel like the baking soda in the toothpaste is a really good ingredient to help your teeth look whiter. Also, over-the-counter whitening strips. The only thing is they cause sensitivity, which is, some people might not like it, but I don't think it really damages your teeth as much. So over-the-counter whitening like Crest White strips, sometimes going to your dentist, they'll do in-office whitening, so very safe stuff, as well as the take-home whitening gels that you can buy online.
Okay. Zona nei kano ma'am, ban parme ulai Pastor sang puyen hinaran ka lang. Oh, that's me, sorry.
That's so cool.
All right, thank you. My question is, what is your recommendation for the toothpaste? Are they all the same, or some brand are better than the other? Is there any, what is your recommendation for the toothpaste?
So they're not all the same. It's really depending on your specific need. So like Rebecca mentioned, like if you want to whiten your teeth, you would go for ones that are focused more on whitening, like Colgate Whitening, Optic White, those different brands. If you have sensitivity, if that's your issue, maybe something like Sensodyne. If your teeth has, weak enamel, Pronamel is the one that you want to go. But I think as long as it's ADA recommended, that means it's been tested, so we know that it's beneficial to you. So having the ADA logo. Also, if it has fluoride. So dentists, we love fluoride. It's a controversial topic, but if it has fluoride in it, it's anti-cavity, so it's beneficial. And then, like, I use Colgate Total. That's my personal preference because my issue is plaque. I get the buildup on my teeth more, so that's why I use that one. But it's based on your needs. But as long as it has fluoride in it, as long as it's ADA recommended, those are, to me, the more important things.
I should not have any question at this age. But I still have. I usually follow the pretty good, I think, every day, morning and night, I brush my teeth. But I don't use this kind of toothpaste for a long, long time when I was younger. And I use like we make a powder of charcoal, then you put a little bit salt, then we use that one to clean it. But that one is a long time ago. They don't do that anymore. But nowadays, how often do you change toothbrush?
Toothbrush?
Even though I have my own habit, but sometimes I change only when it is not, not very good.
Right. I say every 3 months is the best practice, 3 months. Yeah. Some still have theirs from last year. No, I say every 3 months. So like when the next season is there, I always switch mine out.
Hello, mom ka tia chan ni khata voi ni hano tur kha jing zan nge nia choi khaba piang nge ti le ha kher te hi ha kher ai pitap ta ki chon kar kher thina ha kher te hi ni khata voi ng zan nge kher thang.
The question is it better to brush your teeth morning and evening on a set time or after meals? And the second question is, what about, is it toothpicks? Is it safe to use them? How often should you pick your teeth using the little toothpicks?
So he also mentioned, because you mentioned 2 times a day, so he was wondering if it's morning and night or just recommendations.
Yes, so we recommend, yes, morning and nighttime. If a lot of people will brush before eating in the mornings, and that's perfectly okay. After eating, I would suggest wait about 30 minutes. The reason why is the chemistry of our saliva changes during that time. So if we brush right after, we might be causing more damage. So waiting about 30 minutes after eating is best. And then, like I said, morning and nighttime. And then as far as flossing goes or toothpick is okay. That's perfectly all right. I would say just don't put too much pressure that you're damaging your gums. Yeah, but I recommend toothpick for people who like have trouble, like more space in their teeth.
Jing le zan hano tur khania choi kham na no don point da kar chan vetal choi kham nu da kar chan vetal nga ti kha tha chuan ha kher kha apoi lem lo ma se ti nat lutuk lo ti ni chu
Zona nei kan lo mem. Pi mai kha ngai thla tha khop mai zona nei ka ringa.
Cái bộ hi hanget te kan lo nei ta mo kha hanget kha doctorin a kher fai vek ta ong hunga kha anan thol lu le a khami thola kha kum en za no thak le tur nge I ti kha ka shadu mo chuanin pakhal le chu doctor ne na I rai kha chu in en tur khamin te appointment te min lak ti ra kha ta khanin ka shira ma se thak angai lo nge ani lo pole kan insurance na cover don lo wa min ti sak du ro nge onyang kha ka shadu develop.
The question is, when you have a cavity in your teeth and the dentist fill it for you, or how often should that be refilled? And the second part of the question is maybe it has to do a little bit with insurance and pregnancy. while you're pregnant? Is there a reason why they might not recommend that you see a doctor during pregnancy? Can you comment on that, please?
Sure. So, what was the first question?
The first question is there a certain set time for
Oh,
the
the
filling to be
fillings.
changed?
That's right. It depends. If the filling is, it's like tires in a car, you know. The more frequently you're using it, the more often it has to be replaced. I recommend, sometimes it's minimum 2 years. It has to be filled. Also, it depends on how the doctor filled it. If they did a bad job, sometimes it might need to be filled more often than normal. If it was placed really well, sometimes it's 5-10 years. They can last a long time. But also, like, if you're biting into things very hard, the wear, you know, you're putting too much force on it, it can wear faster. And then as far as pregnancy, we actually recommend don't stop going to see your dentist. You still want to see us regularly, sometimes even more. With pregnant women, we see a lot more bleeding of the gums, and then also things like morning sickness. You know, the acid on the teeth can cause a lot of damage. So we always say, still go see your dentist. You can't have treatment, like a filling done or anything, unless it's an emergency in your first trimester and in your third trimester. So if you did need a procedure, like a filling, cavity, root canal, extraction, second trimester, which is the safest. But otherwise, you can still go in anytime for your cleanings. There's no reason not to.
Zo na masa zo khan ha nget min lo thun kha sakha kum ni vel tal chu tlang pui chen dai tur ania ma se man rim lu tuka ni lo pon ha doctorina lo ti that tok lo chuan ai ma de le ka wa thun kha ti le po tu thaya chuan rai lai khan va ti fai tir zia kha chu poimia lo wa chuan kal fo kha a tha zo ka ma se ha phoi don te mo kha tiang root canal and see how tak chin kha chu thla thum thali le thla rukin kar ni chu mo second trimester chu come in kar a tha berang ti ni insurance and cover tur chu ni karing
Ole, zona nei kan lo me.
Hello. Just a quick question. So I be looking at my Instagram reels and I see these purple toothpaste. The science behind it is like purple is the opposite color of yellow, and so when you put purple on yellow teeth, it turns white. Is that like real, or is that just like a fake thing? That's not
I don't
real?
think it's real,
It's not real?
personally.
Okay.
No.
What about like charcoal toothpaste?
Charcoal, you have to be careful with. I think just because of abrasiveness, that's the issue. So for a time, it may seem like it's making your teeth whiter, and that's what it's doing. Is it's scraping away the outer layer of the tooth. After some point, you're going to scrape away all the good layer, and then you're going to be stuck with the layer that's really, really yellow. So also going back to your question about the purple toothpaste, sometimes everybody's tooth is a different color. So there's different shades of teeth. So sometimes it's just the genetics. So I don't think using the purple will affect that part.
All right, thank you.
Na ho ma zona kha kan shia ke ton la hi online na Instagram ve la hianin purple toothpaste le a phut powder ve hi tam khop mai mo an sai chan chu ha eng deu hian purple le a eng hi opposite an ni wangin a purple kan man khana eng kha ron ti re var ti khani chu kan doctor hian scientific takin je dia approve om la recommend lo ni chmo zona kan la nei mo ta Daniela
Hello. Okay, my question is, when we brush our teeth, do we also brush our tongues, or do we just leave our tongues?
You brush your tongues too. So I imagine it's like a sponge, right? So like imagine you're brushing dirty dishes with the sponge, and then the sponge is going to get dirty as well. So like you can do it with the tongue scraper. Those you can find online, Amazon, or just I personally, like, I'll use toothpaste and just brush mine. So, but that's very important.
All right, thank you.
You're welcome.
I actually did not know this.
Really?
I mean, I brush my tongue, but usually I just, either my toothbrush has the little, the up, it's not bristles, but the opposite, the bumpy side. So I'll just use that, or I just use my brush. But I didn't know with toothpaste.
Yeah, I use toothpaste
Okay,
personally.
okay. I thought I would just like brush or do the scraper. Okay,
Also, like with the scraper, I feel like it's not deep enough sometimes.
okay. Good to know. Let me ask, okay? Kan lay not, who brushes our tongue? Okay, this is a pretty, vang in ban in par me tani thei me thea. To when go shan ying chan nan. Okay, question kan la name. Anybody else have another question? Okay, Ani Janin, Dr. Binsi, thank you so much for your time. Hey, da roka rito maya. Lucky draw kan nayanga zan banga paper kala o memo kashilawa pastor sang pui hamin lo boss ay success on. Tun kan health seminar chunga kan gift labang ala oma chung tu kan lucky draw. Lucky draw kan ti chung kanin voin til tam taka imbo say man lawa mase tem ka imbo say til panivel cha karon say zo kanga. Hey kan shatewa tro emergency ni chuanin kung eka presenter hika humia lawa. Okay. Emergency ni chuan 911 ti kan shata. Tro. Ramdang akal taila 911 ni lo na ramom tlat me 911 ni lo chuan ramdang in zin huna nge in call ang kan siam mo. 199 ti te oma. 211 ti te oma kaka. Kan vagyas na sa sodve. Aka number kan siya tangay ni atlang po in US le atsevel ahi chuanin 911 so ani thonan European ram 10 kadate hian 911 ani lo na omani mo chuan tuna kan 119 po kan soya Korea lama po hian number dangan neita abik takin Europe lampang kan ni chuanin a number akhanin 112 ti te po amani mo kha kan kal na huna zir hianin kanin kan lo va in enangai ti hani chu karon soidom zia chu ramdang ain lo zin palani chuan 911 ringo ta khanin in ring lawin hemi rama hian nge an emergency number ti kha zonnan kanin ngei to cha ti kha karon sayo chuan poison mo in lama hian in poison lo ta se enge a line number ha kan shalo tam takan om don ta hei hi number ni mo 800 ka chu kan chata so shia ta olitok 222 1222 mo ina tani se kan na thona po ni se school lama po ni se tro kan no pang takha poisoning ompal chuanin 800 222 1222 kan zawai sai hong wo ready 800 222 1222 one pakhate kha alai lo in zep zopa adang pathum chu 2 kha voi thung om ti khamo kan shadola nia chuan hei hi ke mani na kan lo in ready theya na ti chuan ending e tun seminar chung hianin kan Hriselna tu ke mani ta than tu tam tak kan zir to ta chuan thil pakhat kan ko shana tangi jani kan ti zan lo ani in ka sha ma se kan thil ti thei pakhat mo community ya in prepare ngai lu tuk lawa everyday day to day normal life kan ompa kan thil ti thei pakhat chung e ti cham blood donation kan pe thei ti karon sai do tam tak Hrisel kan oma kan Hrisel tha chuanin blood donation mamo hin tam em mai ani chuan kan blood type hi nge ti kan shem shalo te bo kan om mai thei tro doctor ne la kan kala blood and draw to kan blood and test to chuan kan in siang ka pa hi ni shem ka fian man she to ni chu nge blood type le nge chu ni mo kha tak khani ka zo do na chan chu attention, some of us, we know that our blood type is OB, but sometimes we don't know if we're B positive, O positive, negative. Attention, hey, if we look at the table right here, mo a compatibility ka omtani. Tekinana emergency alo omta se enge blood type and tian zo tu zeu chuanin. It could be anywhere, in the hospital system most of the time they will test. Mo, test sa and they know, but sometimes maybe you're in a situation where you have to verbally tell someone your blood type. Might happen, might not. Base kan ngai to chuanin we have to know whether we're positive or negative. Mo O negative kan ibangin O negative ni nga so negative yang O negative we are known as the universal donor. Omsia to O negative blood type ne piang chuanin blood type dang te na khanin thisen kan pevek thayani. college ka kai lai khanin American Red Cross ka kan skulan ron kala blood donation drive kan ron ni mo at Andrews University we had a blood donation drive and I'm O negative so my one-time donation I keep getting calls after several months because they really just want my blood on the opposite side AB positive kan bunga so pakhatsaw na isamo AB positive can only donate to AB positive. Are you AB positive? Okay, we're completely opposites then. Dr. Vinci is AB positive. So that means in any situations, Dr. Vinci could only donate to AB positive. However, Dr. Vinci can receive blood type of any blood type. So kan mutiamem, annoy la matsukla mahit recipient mo andon take kanita. So AB kajwanin. Oh. So that tak chuan kan film khurang ai na chone ta tro o kan ni ti runga khan positive ne na tangin thisen lo dong ta la I thisen kha I tak sa kan in fight don ta ni mo khata khanin kan blood type te poi mo ka sei do ber jok chu blood donation hi ahar salu tuklawa kan Hrisel pa nga ya chote kan age ha exert te kan la tha nat na kan nei lu tuklo ni chon if we are healthy individuals this is something that we can do easily mo there are lots of blood drives around the city counties so one website we can go is right here redcrossblood.org more American or you can just type Google akan American Red Cross or blood donation tin han type ta wala aron lang don ani so ta chuanin hey make an appointment ti oma donate blood mo hosting a blood drive ti te tam taka om ta chuan alaya mi hi kan hunga hey am I eligible donate turin an pom don sem ti kha lisan ziak sabo kan ni so va apply huna po khanen lo pom lo so chuan an shil thei me so ten kha chu shriao lau kan om ta needle right some of us are scared Tony Kachano she's studying in med school right now. Mase blood donation nakal dona piang kan something with it. Na ati thaingan ya lo de doctor chu ni dona tu na yan. Amaglo to khatyang kha am veni mo but it's safe. There's different types of blood donation. In thisen pum puya donate te oma plasma chau donate te oma platelet donate te oma khatyang khanin athan theibo kani. He kan tlangwa te poshisel tak tak an oma mo. Blood donation in loti theitani chuanin donate ma khanin there's certain foods and certain vegetables and eitur ta kha mani mo khatyang khanin kan lo in prepare sa theya ma second blood type kan sha thei chuanin a thang ti ga win na kanon sei tel bo kani chumo boin chu hun kan nei to lo hei kan nurse lang tlangwa ka tile don ta pusang te anu pangtei sayang tangin pusang te fanai pasang te fan ai po aron kalamaro chu hun kan nei to lo wang voina chuan kan ti thei karing lo next health seminar kan nei le khuna kan zir tur poi mo em chenge ti chuan CPR kan zira ngai ni CPR hi pinu te hi anin amenikin mo alem kan practice na tur hi nei ma se voini iron kalrem chang lo bok nen example han ti bai don hin amenikin om lo kha chuanin aharani apush na turte hetia zoite ti tura hin kan lo ngai thina ani mia lo mo ahar sa chu wangin next kan nei le khuna emo health ministry na hun kan nei chuanin CPR hi kan zir hawang ti ha karon soi do ni mo CPR khawin nia chan details in kal hun kan nei to lawa he no pang emo an kuma zirte no pang puiting position te dang vekati dan tur arang lamte engtika athuk lampang te mo khatyang te kha injir na tur tam tak ama voinia chan hun sei no hun kan nei to lawa ma se hunin nei chuanin ina lo en ro ti kha voinia chan karon in fui du zoka YouTube a hian tam many you just type on YouTube CPR you can do like simple steps this is a good video hey hi ina dang tyang hi en tur om ta step by step this is really important to educate ourselves Atsansu kanchung kwa mo kanchung ko zinga. Unfortunate things can happen to anybody. There are undiagnosed diseases. Doctor din nena kanin entir ma akan lo share lo nan te kan nei thaya chu nga te chuanin CPR kan mamo thut hun hi a om thaya ni. Engti kum nga ni ta khapute kanin kyang pa atluk kan mu kha rele to COVID live kanin ka sha. Yes, I think it was during the peak of COVID 2020, one of our neighbors fell right in front, and we were on a walk. My uncle and cousin kan patuming kan na walk. So I held the cousin and my uncle did CPR on him. อันนี้พอเราปุตเตพอเราเชียร์ตัวครั้งแต่ข้าป่วยหมอเลยตัวก็มีแต่นุนกันฉันเทเรื่องเราเตะกันนี่หุ่นกันเราเปียก็ maybe 10 minutes or so อย่างจีน่านะหุ่นกันเราอินเปียกันมีตั้มตะกันเราฉันผ่าเทียจู่ๆเนี่ยเรากันชุ่มกันตานปกันเราจังกายเทนี่ตัวอินาหุ่นกันในจัน CPR กันเราจีบอกตัวนี้ก็ล้อมไหมโอเคตาเฮียนี่ให้ gift กันในนัวละlucky draw กันติเลตัวไม่ยังจุด draw กัน lucky lucky thầy biết khi con chắc mấy there's just some individuals in the church that just have the lucky draw in them. Apple TV ka dule kan min close sak dan ne kalame.
Ming lo omlo ka zia bel tur kha pipari stern ka ziak luta. Ming lo omlo mo. Nang ta chu. Organize so ne. Pusak te ming omlo mo. Jonathan Rowat te unau ka ziak luta pima eng in nen. Pusang te Jose om iming om. Kan kwalian hi kan sia kan emma te. No? Why not? Maybe we should have a special gift for her. Okay. All right. Maybe we'll invite our guest. Dr. Binsi, can you come and draw for us? Who would be the lucky persons today? We have 1, 2, 3, 4, 5, 6 gifts. What are the gifts, Mate?
Okay, so we have our glucometer, our glucose.
Oh, blood sugar.
Check na. So on blood pressure in check na.
BP test na.
So on this is
Stanley.
Stanley tunlaya mo. Motor ka mega Stanley check motor chuwa kaya chari. Chuwa
Kang Taylor.
Kang Taylor chari chuwa. It did not burn in the car, so it's Stanley. So on it any water bottle ta oma. This is I think the one that gives you the numbers and traces, so it reminds you when to drink your water. And then last but not least, this one is our shiatsu foot massager.
Okay, massage na. How should we do it? Is it the person who we pick first will get to choose whatever, right?
So what do you think I got? I think that's fair. And then last but not the least, $25 gift card off.
Okay. Kaziak lut tun kha. Kam mu ka chu ni dang om lo tur kha chu kaziak lut sewa in tel. Okay. Pi moi pui Daniel om lo mo. Okay. Daniel kan zia lu ngai ni chu.
Pi moi pui ta chung kwa hi an lo om te ve nya. Thu dan ta.
Puku man dong ta. Benale donga. Okay, let's shake it one more time and mix stock dong ta. Okay, doctor. Let's see. Puma Luna. Man, nizan kana mi pia pui ka. Nu pai nan hon don ne. Du ron pick up ang. BP. BP test na la la mo me. Okay. Oh, Daniel Changte. Minga om lo tia, alo om tatak 5 seconds. 5. Gift card takay duem. Mini mo. Oh. Foot massage na. Okay, massage na hon don eh. Okay. Okay, well, maybe that. I don't know. We'll do this. Melody rin digi. An ni po an chung kwai nan dong lek ve ka ni. An fanu panin an dong to an van nei le. Should we do it again? Okay. Yeah. And find a multi blood sugar test na. Okay, lom and patum alom. We have 3 more gifts. Okay. Tlangwa lom sang puya. Omlo, he's not here. Omlo lai tagani puya. Okay. Zo lupui. Omlo, not here. Okay. Hey chu dong to.
Weeding out.
Dong to kha chu kan ti lo ma yang zan tang an dong to. David. Gift card. Gift card ala nal mai ti khan dollar som ni panga adu tu lei thai ni. Okay. Okay, tung nghe ni hey. Sang tei sai lo. Tiếng nghe pu thang à kha in nu hi khiang te vua tir lo ni mo tiếng nghe sai lo la ni tlat ni. Bottle thau. An ni chung kwa po an a chan ve nan dong. Rin zuala na dong to lo mong khap mai. The last but not the least. A top ver na. Dun 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 dun. Tung nghe ni. Jonathan. Maybe our guest doctor can present this as this is the final gift. Thank you, thank you.
When nia kan health seminar le kan AY program chu khati zong khania lo kala lo income zong zong te kan lo ma hai pi moi pui po a to khleng a thu thai sha mani a mi ta ching chan ta ma kan lok pui thau ka bai sia ni danga program kan nei ze la po ko shmem ba ta zinga tang po ni se topic shat chak te kan nei chani hang te po kha kan focus thei ka ringa ma saber het yang hun chamin pe a kan program te klong taka kan zo fel thei wangin pathian ning fakin omro se kan program kan kharnan la pakhat kan sahonga ti chuan bana tong chai kha an chung kwai nan dong tam boka pukhu ma tong chai toring kan som don ania la thang du te kan omem number pathum na kha enge ni kha kan tin e chu Harma sela inge zom kha Harma sela la liswa ka chenna ai chuan ti khamin rang ka chwa lo nya kan zani lo ding angu
Harma sela li swa ka chenna ai chwa ka thang song re theina song song bo min nem tu ang khan ka lal riang bai chu tu na hian ba na ro re ni na o man ti
เราต้องตายงูเอาลปากันป่าวันเราปุยมีวันจนนี้ยิงลำปังชวนหุ่นเตลป่ากันมังจอนหุ่นจานี่น่าไว้อินคอมนั่นเตมังเละเทตัวเราลป่าmember จงให้มีให้จงไม่กันเราก็คอมเทวังลมทุกันสิลเจนี่ไว้กันคอมนากันจิตักทะคักลป่ากันทิ้งลงเชียดเฟียนะมีนั่นในตีละกันตุนการช่วงกันสิจงเตปอขากันนี่ง่ายทัดตัวเตตันจงตักสัจจนะตำนะกันเราในผาเทอันนี้เทง่ายตุนลป่ามาหันสอมังเจจุดต้องจุดสวมิงกันเดียเลยอาเมน
ชูนักันพวกตัวนั้นกันไม่เนี่ยกันจันลากันนะบอกให้กัน leader เบอร์ดัมบอกสิแล้ววะไอ้กันโอเลงอ่ะฉลายเตะyard sale กันในโดน fundraising อันนี้ไงไอ้ตัวรอมโดนบอกตุน